Welcome back. 46 past the hour, and well, 'tis the season. Fall is approaching, and that means we can expect an uptick in flu and COVID cases.
In fact, the U.S. is already reporting an increase in COVID-related hospitalizations in some states. Now, doctors are urging residents to get vaccinated against the flu and COVID-19.
The Food and Drug Administration this week approved updated COVID boosters from both Pfizer and Moderna that target the strains that are currently circulating.
So joining us now live in studio to talk about all of that and, of course, the upcoming flu vaccine clinic is Dr. Dustin Ellis, Chief of Staff over at Sullivan Community Hospital. Good morning. Thanks for joining us.
Good morning. Thanks for having me.
Okay, so where do we stand locally when it comes to those flu and COVID cases?
So we're starting to see an uptick locally in cases of flu, cases of COVID. It seems like every fall when school gets back in session, we start seeing some illness circulating locally, so we are seeing a slight increase in numbers.
So why do we see that in the cooler when the cooler weather arrives?
I think it's a couple different factors, mostly people gathering indoors, closer quarters, and then it just seems to be the time of year that those illnesses like to spike.
And like you said, I mean, it kind of just comes with the time of the year, I suppose. But what are some things that people can, or ways that people can protect themselves? Because I know one big concern that parents have is RSV.
So RSV is a concern. There are actually some new recommendations for people to be vaccinated, adults, which is fairly new, but the simple things still work really well. So I urge people to stay home when they're sick. Good hand washing. We saw a big decrease in flu cases during the COVID pandemic, so that was a sign that those simple measures and taking those precautions actually do work.
So this week, the FDA signed off on 2 new COVID-19 booster shots. What can you tell us about that and about the vaccine just overall?
So this is hot off the press that these new vaccines are approved, and they're going to cover different strains of the COVID-19 virus than what the previous vaccines have covered. So even if people have been vaccinated recently, they're still going to be eligible for this booster. And the CDC is currently recommending basically anybody over the age of 6 months to get this.
And if anyone is anxious about getting vaccinated, what advice would you have to them?
I advise people to talk to their physician. Talk about your risk factors, talk about the likelihood of severe illness, hospitalization, death with your particular case, and then you can decide what's right for you.
All right, well, that sounds like a plan. You guys are going to be holding a community drive-through vaccine clinic for the flu later this month. Tell us about that.
We are. So with all the COVID talk, influenza kind of seems to get a back seat at times, but we are still very concerned about the upcoming flu season. People are welcome to come to Sullivan County Community Hospital. It's going to be simple, drive-through, get your flu shot. We know that we can decrease the incidence of hospitalizations and death if we can get people vaccinated for influenza.
You know, I hear often that people say, well, I don't want to get the vaccine because it's going to make me sick. The flu vaccine is going to give me the flu.
It's a common misconception. It's not a live virus, so it will not make you sick. It will not give you the flu. You can have some side effects, some low-grade fever, some muscle soreness, those kind of things, but it will not give you influenza.
All right, well, good advice from the doc. Go ahead and get those vaccines and go to the community clinics as well. We have all that information right there's the website, and we'll have much more information on our website, mywellbashvalley.com.
Thank you so much for joining us this morning.
Thank you.